Hello, everyone. In this revision lesson today, we'll be discussing Beck's depression inventory, also referred to as BDI. To be able to do so, I've picked up this paper from May-June 2024 from variant 3.2 A2 Psychology, focusing on the clinical psychology questions. That is question number 1, 2, 3, and 4. Amongst those questions, this is question number 3 over here. Now, before we get started, let's give the question a read so that we understand what sort of questions we should be expecting in our examinations. Dr. Begum is a clinician who sees a patient, Joan. Let's register this first. Dr. Begum is a clinician who sees a patient with the name Joan. Joan describes how she spends her day feeling miserable and not knowing what to do with her time. So, this patient over here spends her day feeling miserable and does not know what to do with her time. She thinks it is her own fault because she cannot decide if she wants to go out, so she stays in. Now she is blaming herself because very clearly sees this as her own fault because she is indecisive. She cannot really decide if she wants to go out or not, because of which she ends up staying in. Joan wants to sleep, but this is also difficult. So, summing this information up, we are talking about two people over here. One's the clinician, Dr. Begum, and the other one is a patient with the name Joan. Joan describes how she spends her day feeling miserable. One, this lady feels miserable throughout the day, and she does not know what to do with her time. Number two, she thinks it's her own fault. Number three, because she cannot decide if she wants to go out or not. She finds herself not being able to make a decision, which consequently results in her staying in. John wants to sleep, but it is difficult. So, the sixth point. Now, just keep these points in mind. Let's have a look at the question here. The question suggest how Dr. Begum could use the Beck depression inventory with Joanne. So for this, we need to know what the Beck depression inventory is. But before we get started with this, let's have a look at the guidance that has been provided to us by the Cambridge. Cap at 2 marks, outlining the features of BDI with no link to Joanne or how it can be used with her. So the question not only demands your knowledge on BDI, that is Beck's depression inventory, but at the same time, you should be able to apply a knowledge as well. And you'd be able to apply a knowledge and you'd be able to demonstrate to the examiner that you're capable of applying this knowledge by forming a link with the situation that has been put in front of you and actually putting this to use to be able to help Joan, the patient. Now, number two, cap at 3 marks if no reference is made to John specifically. Now, specifically as in one of her symptoms, remember when I was marking down the symptoms there, but the response refers to how Dr. Begum can use the BDI with John, that is through a diagnosis. Now, keep these things in mind. There are so many students who end up, I see them being confused over why they do not receive 4 on 4. Why is it that they end up receiving 3 on 4 or 2 on 4? These are the things that need to be understood. If the Cambridge is publishing them, they're publishing them for you. They're publishing them so that you understand what is to be done and what is to be avoided. Now, moving back to the question again, suggest how Dr. Begum could use the BDI with Joanne. Having looked at the generic marking scheme, award 3 to 4 marks for a detailed answer with clear understanding of using BDI with Joanne. So one, we required to provide a detailed answer. Number two, that should demonstrate clear understanding of the usage of BDI with Joanne. Keep these 4 factors in mind. Remember, this is a 4-mark question. What is BDI? That is Beck's depression inventory. Look at how amazingly this marking scheme has been done. I mean, we could use the same marking scheme for revision purpose as well. So about BDI, it is a psychometric measure. It's a 21-item multiple choice questionnaire. 21 item, 1, number 2, multiple choice questionnaire. Let's turn this into a rainbow here. It is a psychometric self-report measure that measures the severity of depression. Let's pick up another color. The patient reads various statements and answers with how much the statement applies to them. How much the statement applies to them, right? On a scale of 0 to 3 or 4-point scale over the past 2 weeks. The statements cover issues such as self-dislike, tiredness, etc. Issues such as self-dislike and tiredness, etc. are catered to over here. The higher the score, the more depressed the person is deemed to be. Now, just look at this. This looks like a rainbow to me. So about the Beck's depression inventory, number 121 item, scale number 2 comprised of multiple choice questionnaires, number 3 psychometric measures, number 4 self-report measures, a self-report measure, number 5 helps measure the severity of depression, number 6 the patient reads various statements and answers with how much a particular statement applies to him or her. Number 8, there's a scale that ranges from either 0 to 3 or 0 to 4. Through this scale, you need to see the extent to which a particular statement applies to you and keeping the last 2 weeks in mind. The statement covers issues such as self-dislike and tiredness. We saw both of them with Joanne, etc. The higher the score, the more depressed the person is deemed to be. Now, see, 11 points. We have 11 points right in front of us, and I've picked this up right in front of you from the marking scheme. If you do not know them, you might as well pause here, learn them right away. Alternatively, if you have a notebook in front of you, just list them all down. If you write them, if you put your pen to paper, it's going to help you remember them, recall them later whenever you require them. Now, moving on. An example of such a statement could be, I do not feel sad, I feel sad. I'm sad at the time and I can't snap out of it. I'm so sad or unhappy that I can't stand it. Now, over here, these ups and downs are considered normal. I mean, this is how, based on the score, this is the criteria, or this is how the scores are operationalized over here. 1 to 10 is these ups and downs are considered normal. 11 to 16 is mild mood disturbance. 17 to 20 is borderline clinical depression. 21 to 30 is moderate depression. 31 to 40 is severe depression. And over 40 is extreme depression, right? Now, taking this ahead, if we talk about another version to this, so this just adds on to the validity. This is continuously being updated. Version 2 got rid of the statements that had the same scoring. Version 3 changed questions on body image, hypochondria, and difficulty working and added in questions to sleep loss and appetite. Body image, you know what it is. Hypochondriacs are people who feel they're sick even when they're not, which consequently results in them visiting doctors a lot. Difficulty in terms of working, maybe concentration, and added in questions that had to do with sleep loss and appetite. For example, you could write, now this is how you hit a 4 and 4 here, right? Dr. Begum could use the Beck's depression inventory with Joan, where she would read 21 statements and answers on a 0 to 3 scale over the past week. Joan will likely give high scores to the statements about sadness, sleep, losing interest in other people. She might also score highly on feeling she is worse than other people, and feeling like a failure as she thinks it is her fault. A score of over 21 would indicate a diagnosis of depression, as this is moderate depression, or a score over 17 might be considered for a diagnosis of depression, as this is borderline clinical depression. Now, do you see the minute details that the examiner is expecting from you? Now, this, I believe, in itself should answer the question when students ask about why A2 psychology grade threshold is super low. For May 2024, for May 2024, Zone 4 version, it was 53%, I believe, for an A grade. Now, this is why, because, majority of students, they do not spend time on figuring out how a question needs to be attempted. It's not about just knowing what BDI is. Now, BDI is simple. BDI could be, I mean, this is BDI, this is BDI, this is how you evaluate BDI, and that's pretty much it. But how is it that we actually put all of this information to use is actually what counts over here. And along with this, the examiners also give an option where they say other appropriate responses should also be credited. See, this is not difficult. It's about knowing what the content is and being able to apply it. Along with being able to apply it, understand, kindly spend time, invest time understanding how these questions need to be answered. If you want to score good, know the marking mechanism, know what the Cambridge is expecting from you. Now, taking this a little ahead, moving on to 3B part over here. Explain one reason for the same questions. It's the same situation, two people, Dr. Begum, the clinician, and John, the patient. Explain one reason why the Beck depression inventory is valid. So, in other words, you're expected to give expected to give one advantage, one strength of BDI in terms of how its validity is high. So remember, it has to be one reason. Okay, focus on that. It has to be one reason. So one reason being elaborated enough so that you hit a 2 on 2 over here. Having a quick look at the guidance, allow reference to either ICD 11 or DSM 5, both. Objective data can be credited where the response explains that the clinician isn't interpreting the response of the patient. There isn't much of interpretation that is required from the patient's end, because remember we had the scoring criteria where I use the word operationalization that is already available. So there should be another point: no credit to identify that the data is objective or quantitative on its own. I mean, by just writing down the data as objective or quantitative doesn't really help you. You need to explain how it is objective, right? So focus on the how part here. Moving on, having a quick look at this. Award 2 marks for an explanation of why BDI is valid. The likely answers could possibly be: there are 21 items, so the measure is valid as measuring a wide variety of symptoms of mood or affective disorder, includes both cognitive and physical symptoms, example, sadness or sleep. Number two, another option, there's a choice of 4 items per statement rather than yes or no responses. This gives the respondent an opportunity to express how they feel in more depth. Number three, good validity as it covers the symptoms for depression that are in the ICD 11, such as depressed mood and loss of interest in activities. Number four, good concurrent validity with Hamilton Psychiatric Scale, another measure of depression. The BDI has a positive correlation with the HAMD, and HAMD over here is the Hamilton Psychiatric Scale. It is okay if you do not remember this. There are other points that could help you get marks too. But just because you've opened it, you might as well spare a couple of seconds and learn this right away. Concurrent validity, I'd like to assume you all know what concurrent validity is: when your measure is pretty much in line with another popular or another highly valid measure. Now, an example of this could be the Beck depression inventory is a valid way to measure depression as it includes 21 items, so measures a wide variety of symptoms. These symptoms include both cognitive and physical symptoms, so patient with different types of symptoms, the example, mainly cognitive, could receive a diagnosis of depression. Now, this, I hope, has helped you revise what BDI is and actually put to use the information that you by now should be aware of. Put it to use when it comes to answering a question in your CAIEs. I hope this has been helpful. Thank you.